Ah, that's all right. Everyone makes mistakes, right? And you know what they say, practice makes perfect. You know who I'd like to not hear that from, though? My surgeon. You know, I'm new to this, but practice makes perfect.
I am a surgeon!
Thankfully, that's not what happens. But that makes you think. How do we train surgeons? Surely they don't go into a game of operation and, okay, you passed. You can go operate on a live patient. It's a bit more high-tech than that. From the acces hospital, I'll be your doctor for the day. Take a deep breath. It'll only hurt a bit. For most of human history, surgeons have had two ways to learn. The first is live patients, which, for the reasons I've laid out before, isn't ideal. The second is cadavers, which isn't ideal either. I went to Eastern Hospital in Hong Kong to talk to someone who's been helping train surgeons for more than 20 years.
All the results depend on the skill of the surgeon. I'm Dr. Carrison Tong. We use CNC techniques to do models like this one. There's a lot of limitations on CNC in material and the strength and also manufacturing cost.
CNCs allow for high precision control over a drill. That's useful for recreating hard things like bones, but you can't recreate tissue, like skin or muscle. But CNCs are no longer the only option.
I'm running a 3D printing project in hospital authorities. Then we use CT, MR, and PET data, and then we create a model because of our data is from real patient, so that it's structurally correct. We have the robotic surgery, so that our surgeons ask me to create a 3D model for them. When you go to the old operation theater, when you open the patient, everything is bloody. There's only one color, red. Here is easier. I can show different colors for them. It's easier for them. But the model should be transparent so that they can see the vessels, the artery, vein, and the ureter. They use this as a map for the during the operation theater. The surgeon bring this inside the operation theater. Since we have robotic surgery, the surgeon, he can control the robot and he can look at this model in front of him. The patient is sitting there. Our doctors need to use a needle to punch it. The problem is that that's the lungs. If he touches the lungs, it's dangerous. Unfortunately, the shape of the lungs deforms. Nobody knows what kind of shape it is. So that we need to use ultrasound to punch and to drain out the water. Then there's difficulty. It's important because during the pandemic, the ICU, A&E, and medical departments have a lot of patients like that. A lot of doctors, before they use the needle for the patient, they try out a model first. Then they can clearly find out the tumor and then cut the tumor accurately. He can save the kidney. He don't need to, the patient do not need to wait for the kidney transplant. I think it is the technology we need to further, because the queue for kidney transplant is quite long in Hong Kong. Before, there's the rule, they call it see one, do one, and teach one. But since we have this kind of model, doctors can do more. They can try many times before they do the real patients, and then so that they can teach. We can further develop these techniques in other applications. We need more dreamers in hospitals. I think it's good to have more people in this field so that we can produce more realistic models. Then it will be benefits for both for patients, doctors, and the management.
Oh, the operation was a success. Take your time waking up. If you're interested in learning more about how 3D printing can be used in the medical field, we've got some links for you in the description. Now, if you don't mind subscribing just here, and I'm sorry, I've got to go. I've got to tend to another patient. Take care.